Larry actually caught me at a basketball game. He said, I'm just not feeling good, and I want to know if you'll see me sometime, and we sat down and kind of visited a little bit. And I said, well, I think that based on what you're telling me, we better probably take a closer look at some things. So I brought him into the clinic and started looking around for why he was having bad leg pain initially. So the visit kind of changed from leg pain when he told me that he just felt like he couldn't do anything anymore. This is a guy that is very athletic, has biked all over the country, and I was mortified to hear that he felt like just walking up this walk he got breathless. And so it quickly changed from just the neuropathy to figuring out what was wrong with the breathlessness. And in a process of working that up, he has a longstanding history of lupus, which he thought was the cause of this. And so we worked up what other reasons could cause neuropathy. And we were in the process of working up the neuropathy and getting the heart worked up because I thought he might have a problem with his heart or lungs. And in the process of working that up, his blood work came back that he had anemia, which I thought was odd because he's pretty healthy, good diet, had regular screening colonoscopies, and his anemia didn't fit the profile of iron deficiency. It was macrocytic, but pretty profoundly anemic. And when I got his levels back for his heavy metals, his arsenic levels were high. Arsenic, if you have an acute poisoning, it's like very high levels, but this looked like more of a chronic long-term poisoning. And so I thought maybe it was in his groundwater. That would be the most common place, but he's on city water, so that wasn't going to be the cause for it. And he was taking quite a few different supplements trying to help himself with this chronic pain he gets from his lupus. And so we thought it's probably related to supplements.
Some of the supplements I've been taking probably for 5-6 years. I've had diagnosed with lupus about 8 years ago, and they say there's no cure, so I'm looking for the cure, And so some of them I've been taking at least 6 years, and I think I brought 6 different supplements in that I've been taking.
I had arranged for an echocardiogram for Larry upstairs, and the echocardiogram tech called down and said, Dr. Falkenburg, Larry's heart rate's 28. I said, send him over to the emergency department, I'll be right up. So one of the great things about rural medicine is I'm in the clinic, and I walked upstairs, and they had the nurses obviously were very concerned because his heart rate was 28, but he was really asymptomatic. He didn't know why we were all so concerned about him, and felt, other than a little breathless, felt pretty good, no chest pain or anything like that, and blood pressures were stable. And I talked with cardiology, and we sent him up for a pacemaker to be placed. And cardiomyopathy, which gives you the electrical abnormalities that he was experiencing, can be caused by both lupus or arsenic. And so it's a little bit confusing which one of those was the culprit. I personally think he's not having any lupus flares. He doesn't have any current high serum markers for inflammation. I personally think it's probably related to the arsenic too, but we won't know. The long and short is that he feels awesome with his pacemaker.
I have stopped all. I'm on some prescription drugs, of course, but I stopped all the supplements, and I feel good. I feel really good.
Yeah. And we've done a follow-up arsenic level, which is normalized. It's no detectable arsenic as soon as he's, as 4 weeks after he stopped the supplements. And the State Department is actually interested in the case because of a public health concern. So they have the pills, and they're running testing on the pills to figure out which one has arsenic in it.